are in your first trimester of pregnancy and you're struggling with nausea, I see you. It's exhausting, it's overwhelming, and it can make even basic tasks feel impossible, but I can help. Here are 3 things that you should know before you start taking any of the nausea medications in pregnancy. Number 1. Taking medications for sickness in pregnancy is safe for your baby, and whilst it is of course difficult for us to perform trials on medications in pregnant women, all the available evidence that we have that's been reported by Cochrane and other systematic reviews and meta-analysis shows that many of these anti-sickness medications that we have been using for decades, like ondansetron and cyclizine, are safe. They don't demonstrate any significant increase in the risk of birth defects or other adverse pregnancy outcomes, so go ahead and don't be afraid of them. Number 2, preventing dehydration is critical. Severe nausea and vomiting can actually lead to you becoming dehydrated or malnourished, and that can increase the risk of complications to your baby like low birth weight or electrolyte imbalances. And this is why we actually say, yes, it is better to avoid becoming dehydrated by taking the medications if you need to, because staying hydrated and well nourished supports your baby's development. So if that medication helps you to keep the food and the fluids down, that is a good thing. Number 3. There are many different options of medications available. Not every medication works the same for everyone. So if one of those medications for your nausea doesn't help, you can ask your doctor to try and adjust the dose or try a different option. And sometimes combining the medications actually works best. You have got choices, and that's a good thing. So it can be a very isolating experience when you cannot confidently leave the house because of how sick you feel, never knowing when you'll next need to be near a toilet. So find someone to talk to, but also remember that if you need nausea medications to get through it, take them without feeling any guilt. A well-fed, hydrated you is the best thing for the both of you. So if you struggle with nausea in your pregnancy, can you share any useful tips you had to get through it below?